Great, thanks Alison, and thanks so much everyone for coming. So as Alison mentioned, I'm Anna, I'm a physio by background and I work as a project manager and research fellow at the University of Leeds. And I'm particularly interested in how we can make health and social care research across all areas more accessible and inclusive for people with lived experience of disability. So today I'm going to be giving some quite broad background initially about inclusion in research and then highlight some examples of good practice specifically around working with people with learning disabilities. So first of all, I just wanted to clarify what we mean when we talk about an underserved group. And that's a term that's been advocated by the NIHR's Include project. And that highlighted there isn't a single definition of an underserved group, but some characteristics that are common to many underserved groups include lower inclusion in research than would be expected from the population estimates, having a high health burden that's not matched by the volume of research for the group, and having different responses to engagement with interventions, with research not accounting for those factors. And we know that people with learning disabilities very much meet these criteria. For example, Spore et al. Reported in The Lancet in 2020 that they'd reviewed over 26,000 NIHR studies and found 60% actually excluded learning disability groups. So then thinking about why we should include underserved groups in research, there are many reasons, such as moral and ethical reasons, scientific reasons like making sure results are generalisable, equity-related reasons, and legal and human rights reasons, including the Equality Act 2010 and the United Nations Convention on the Rights of Persons with Disabilities. And then thirdly, in terms of when we should include underserved groups, that's of course across the research cycle. And the NIHR is actually introducing new requirements for applicants to demonstrate how inclusion is built into the research question and design, the participants recruited, the research methods, and dissemination. So the big question that I've not really included on this slide is how we can actually go about improving inclusion of underserved groups. And related to that, I just wanted to mention a NIHR-funded public involvement project I was involved in. And that's the next slide, please. Super. So this involved the 4 community organisations and 2 university teams shown here, and it involved holding community conversations with a diverse range of groups who'd often be considered underserved by health research. And the community conversations were really to provide an informal space to chat about health research, including barriers to being involved, and also how we could work together with the groups going forwards. So this project was underpinned by a knowledge mobilisation approach. And just for anyone who's not familiar with knowledge mobilisation, that's around research teams and people beyond academia sharing what they know with each other. And the idea is that that can enable the people working together to co-create new knowledge that makes a practical difference in the real world. And you can see from this figure that we were sort of conceptualising knowledge mobilisation, inclusion of underserved groups, and public involvement as 3 distinct but interrelated concepts. So then on the next slide, we've got an illustration here that was from somebody who attended the Leeds Involving People community conversation. And I think it's really capturing how the groups had a real willingness to be involved, but they felt they weren't represented at present. So they felt there needs to be a new path, which is flexible and tailored to diverse groups' needs. So across all the community conversations, we developed 3 take-home messages. These were ensuring relevance, appreciation and trust, prioritising language and accessibility needs, and maximising flexibility in all research-related activities. So one of the suggestions that came out of this project was that it would be helpful for research teams to have disability awareness and accessibility training. So that led on to planning an NIHR Advanced Fellowship application. Next slide, please. Great. So this is around planning how to co-develop, implement and evaluate what we're calling include disability resources. And the idea is that they would help to make health and social care research more inclusive for disabled people. So as part of the discussions for preparing that grant, I was introduced to people from the Research Engagement Network programme run by NHS England. And along with various other people, we've been holding some informal meetings to discuss how we can improve inclusion in research for people with learning disabilities and autistic people. And there's been real enthusiasm to keep that group going. So we're aiming to establish it more formally with a space for sharing resources as well as the informal meetings, and also opening it up to anyone else who's interested. Other discussions linked to my fellowship have led to establishing a global disability inclusion in research collaboration, which has been really valuable for learning from all the sort of good work that's going on in other countries. So what I wanted to move on to next is highlighting the examples of good practice related to including people with learning disabilities in research. And these slides are based on information that's been provided by various different teams who are all represented today. So there'll be a chance to sort of ask any questions about these projects later on. So firstly, I wanted to mention the West Midlands Learning Disabilities Research Network. And this is a collaborative initiative between organisations for people with learning disabilities in the West Midlands and the West Midlands NIHR Regional Research Delivery Network. The aim of this network is to expand opportunities for involvement in high quality research studies for people with learning disabilities. And key areas of work include reaching out to organisations for people with learning disabilities so that they can join the network and find out more about the relevant research opportunities, sharing opportunities with people with learning disabilities, and working with researchers to raise awareness of the network and encourage research teams to register their studies with the network. And the network are also working towards developing a visual resource to explain research and the research process in an accessible way for people with learning disabilities. So then the next project, we've got a nice bright slide here. This is provided by Amy Russell, focused on the No Research About Us Without Us project, which is led by Amy and Gary. And this project involves people with learning disabilities as leaders and co-applicants. And the team are planning to share practical advice on how to make research more inclusive, including how they rewrote a clinical trial to show how it could be made more inclusive, and also their top tips for working together. So this project is part of a portfolio of work for Amy and Gary. And Gary is an advisor on multiple research projects and has a real passion for improving inclusion of people with learning disabilities from diverse backgrounds in research. Amy's a researcher from the University of Leeds who's worked on improving diabetes care for people with learning disabilities. And when Amy was recruiting people to the diabetes research, she realised sort of how much of the way we do research needs to change because of the real sort of challenges she had around that. And Amy is also carrying out a fellowship called Capacity, Consent and Autonomy, and that's exploring barriers to ethical approval for research that includes people with learning disabilities. So that ties in with the next study I wanted to mention. So this is the HIPPY trial, and this is led by a team from the University of Bristol and is aiming to find out which hip implants are the best ones to use in people aged under 70. So the team were really keen to ensure that people from diverse groups had their voices heard in this project. So they worked with the Brandon Trust Adventurers, who are a group of people with learning disabilities and/or autism, to co-produce an accessible information sheet. And the plan was that this accessible information sheet would be provided to all potential participants in the trial as part of a kind of layered approach. But unfortunately, that suggested approach was initially rejected by the Research Ethics Committee. The HIPPY team then challenged that approach, and ultimately that decision was overturned, and that was particularly based on providing evidence from the Brandon Trust Adventurers and also the main patient and public involvement group for the HIPPY trial, who felt that the suggested approach with the accessible leaflet and the layered approach was the best one to take. So just moving on to the next project. Great. This is a slide that was developed by the Brandon Trust Adventurers and provided by Ilan Baru from UWI. And this is a separate project that the adventurers were involved in. And this came about because health professionals have reported being nervous and lacking understanding when communicating with people with a learning disability and/or autism, which can contribute to overprescribing of medicines and poor quality care. So to help address this, the adventurers and university researchers worked together to co-produce communication training to be included in the university prescribing course. And after the training, over 800 prescribers reported improvements in their communication skills with people with a learning disability and/or autism. And the adventurers also reported benefits, such as that they gained a better understanding of the healthcare system and valued being advocates for people with a learning disability and/or autism. So just before I move on to summarising the key take-home messages on the next slide, please. Super. I've got some acknowledgements just to say a really big thank you to everyone who's been involved in the projects I've mentioned in any way, and also particularly to say thank you for people who've provided information for their slides and the slides directly. We've got a few key references on this slide, and then we'll be providing a more detailed reference list after the workshop. So last slide, please, just to highlight our take-home messages. We know that people with learning disabilities are an underserved group in health and social care research. So people in all research teams need to be taking positive actions to improve inclusion across the research cycle. And working together with people with learning disabilities is key at all stages. So I'm really pleased now to be able to hand on to Andrea, because Andrea is going to be talking about how we can actually go about working with people with learning disabilities. And we just wanted to mention that ideally we'd have hoped to have had somebody with lived experience presenting. Unfortunately, that wasn't possible with the timing and structure of this workshop, but Andrea is going to be sharing some videos from some of her colleagues with lived experience, so that will give some really valuable insights.